Well, my friends, this is a rare case, so I do like to make on video. But the gentleman who is aged about 38 years, I do not like to show his face, as he is also one of the medical personality. I do not like to show his face. The problem is avascular necrosis. So the patient went at Manipal hospitals, one of the prestigious medical hospital in India, and already diagnosed bilateral vascular necrosis. Bilateral vascular necrosis of the femoral head, more especially in the left side. So what happens? Difficult to movement. You know the circulation, I am showing one picture of circulation of the body. See, this is the general circulation of the body, you know, from the heart arises the ascending aorta when arches of aorta. From the arch of aorta, branches go to the upper parts of the body to supply the head, neck and brain, known as the common carotid artery. Very soon the common carotid artery divides into two branches, external carotid and internal carotid. The external carotid supplies the face, eye, parotid gland, thyroid gland, etc., outer side of the face. And the internal carotid artery goes to the brain, it supplies to the brain, and with the branches of the vertebral artery, it forms the circles of wheels, etc. So this is the blood supply of the upper parts of the body, I mean the head, neck of the body. Now about the superior extremity, this is the subclavian artery. Sub means below, clavian means from the clavicle এর নিচ থেকে আসে. This subclavian artery when enters into the axilla, it is known as axillary artery. When enters into the brachium, arm, known as brachial artery, and at the cubital fossa, it divides into two branches. Inside of the body, I mean the medial side of the body, I mean the inner side of the body is known as radial artery, and outer side is ulnar artery. So this is the blood circulation of the head and neck. The common carotid artery divides into external carotid artery and internal carotid artery. And the subclavian artery, these are emerges from the arch of aorta. This subclavian artery, when enters into the axilla, known as axillary artery, when enters into the arm, known as brachial artery, at the cubital fossa divides into radial and ulnar artery, and when goes into the palm is from the palmar arch, etc. Now what about the abdomen and thorax? When the arch of aorta enters into the abdomen, into the thorax, known as thoracic abdominal aorta, when crosses the diaphragm enters into the abdomen, known as abdominal aorta. At the lower part of the abdomen, this abdominal aorta divides into two branches, the common carotid artery. And the common carotid artery is further subdivides into two branches, external carotid artery and external iliac artery and internal iliac artery. এখানে যেমন ছিল similarly like this, external carotid and internal carotid. Similarly here, external iliac and internal iliac. The internal iliac supplies the organs of the females, uterus, ovaries, and males, testes, etc. and other parts of the lower abdomen, I mean the organ belongs to the pelvic cavity. The external carotid, external iliac artery enters into the thigh by crossing the ligament known as, I've forgotten the name at this moment. It crosses the inguinal ligament. So inguinal ligament and enters into the thigh, known as femoral artery. Now this femoral artery gives numerous branches. This femoral artery gives numerous branches supplied to the head, neck, etc. Head, neck, and upper part of the femur, the joints of the hip joint, this femoral artery divides into two branches. Now the external iliac artery, when crosses the inguinal ligament, known as femoral artery gives numerous branches. This femoral artery comes into the popliteal fossa and divides into two branches, popliteal artery. And the popliteal artery divides into further two branches, etc., and goes to the lower part of the body. Now the femoral artery supplies the hip joint. Now if the fracture takes place, যদি কখন এখানে ভেঙে যায় তাহলে আর্টারিটাও রাপচার হয়ে যায়। আর্টারিটা রাপচার হয়ে গেলে ব্লাড ঠিক মতন যেতে পারবে না। এই আর্টারিটা যদি এখানে ভেঙে যায়, ফেটে যায়, তাহলে এই জয়েন্টের এ পাশটায় রক্ত যেতে পারছে না, তাহলে একে বলা হয় নেক্রোসিস। ইট ইজ নোন অ্যাজ ভাস্কুলার নেক্রোসিস। সো প্লেটটা দেখি। So this is a very nice picture. This is a very nice picture of the pelvic cavity. So this is the femur. The femur is the This is the head of the femur and forms the hip joint. This femur, this is the greater trochanter, this is the lesser trochanter, and this is the neck of the femur. If sometimes the femur becomes ruptured, these blood, the vessels, the branches of the femoral artery ruptures. So blood circulation disturbs. And the part become necrosis, that is avoid of circulation of blood. So necrosis, avascular necrosis. Avascular necrosis means the bone due to inadequate blood supply. It complicates fracture. Generally the cause is fracture. It complicates fracture when the blood supply of one fragment was derived from the other fragment. এক জায়গার ব্লাডটা অন্য জায়গায় যেতে পারছে না। So after a fracture, the blood supply of one fragment becomes completely deficient and undergoes avascular necrosis. These avascular necrosis will lead to non-union and osteoarthritis of the involved joint. Diagnosis, of course, made by the X-ray, and the changes takes about 1 to 3 months to develop. So this is called the avascular necrosis, and the common site is generally neck of the femur. So sometimes at childhood there may be very সাইলেন্ট ফ্র্যাকচার। অনেক সময় খেলতে গিয়ে অনেক সময় আঘাত লাগে, তখন মতো সেরে যায়, বোনটা হিল আপ হয়ে যায়, কিন্তু পরবর্তীকালে ওই জায়গাটা আস্তে আস্তে অ্যাভাস্কুলার হতে থাকে। ওয়ান অফ দ্য smaller tweaks of the femoral artery may not functioning properly, so that the part becomes avascular, and ultimately at the adulthood or later life avascular necrosis is formed. The gentleman has been suffering from avascular necrosis. So in homeopathy, we know the pathology, we must understand the pathology, we must understand the surgery, the vascular surgery, etc. But we are not sure that always there may be accident, there may be fracture. We may think that many causes of the diseases are due to other causes or psychic, etc. This gentleman got on shock and followed by depression following unnatural death of one of the family member. 2 years back, depression, he was suffering from severe depression following unnatural death of one of the family members, which is followed by hip joint pain and avascular necrosis. Now this is very difficult to him to walk properly. হেঁটে দেখাচ্ছি, আমি মুখ বাদ দিয়ে ওনার ছবিটা দেখাচ্ছি। The walking is so troublesome and difficult for the gentleman. So this is the avascular necrosis of the left hip joint. ঠিক আছে, ব্যাক করুন, এখানে চলে আসুন। Now what will be our prescription? What will be our selection of medicine? There is a cause. We have understood, we have known the surgical cause, the pathological cause. But behind the pathology, there are causes we homeopaths believe that. চলতি বাংলায় যেমন কথা আছে বাবারও বাবা আছে, তেমনি ওই বিশ্বাস করে আমরা মনে করি যে প্যাথোলজি ইজ আ ক্রুড ওয়ান অ্যান্ড দেয়ার মে বি ডাইনামিক প্যাথোলজি. So there may be no history of fracture, but this avascular surgery may also appear from the mental shock, mental grief, mental mortification, etc. And this gentleman got on shock when his family, one of the family members belongs to him, was unnaturally dead. These are for salt, aversion to sweets. So these are for salt, aversion to sweets, sympathetic minded, cannot tolerate injustice, etc. And the depression following the mental grief. My selection is Hahnemann's tinctura sine acris cali. So the bilateral vascular necrosis, bilateral MRI clearly shows bilateral vascular necrosis involving both the femoral head, but especially to the left. But my prescription is in homeopathy, Hahnemann's tinctura sine acris cali, and I do like to prescribe in 50 millisimal scale of potencies, 0/1, 0/2, 0/3, 0/4, 0/5, and 0/6, with the direction thrice in a day, morning, noon, and evening. And let's see the result. Please remember this video number, my friends. I shall share with the follow-up after 3 months. So I have clearly explained the pathology, the surgical procedure, the beginning and formation of this avascular necrosis. Necrosis means death of the tissues. কেন ডেথ হচ্ছে সেটাও বললাম, কারণ ওখানে রক্ত চলাচল পাচ্ছে না। কেন পাচ্ছে না? ডিউ টু সাধারণত কোনো ফ্র্যাকচার হলে বা কোনো আঘাত লাগলে একদিকের ব্লাড আরেক দিকে যেতে পারছে না, পুরো ফেটে যাচ্ছে না, ছিঁড়ে যাচ্ছে না, কিন্তু চুপসে যাচ্ছে, বসে যাচ্ছে। তার কার্যক্ষমতা, নদী যেমন মাঝখানে অনেক বেশি চড়া পড়ে গেলে একদিকের জল আরেক দিকে যেতে পারে না, তেমনি ব্লাড সার্কুলেশন ঠিকমতো পাচ্ছে না, তার ফলে জায়গাটা নেক্রোসিস হয়ে যাচ্ছে। অ্যান্ড দিস ইজ কল্ড necrosis due to blood lack of oxygen, lack of blood supply, and that's why called vascular necrosis. But maybe the disease vascular necrosis, being a homeopath, my prescription is based on entire totality of the patient, to considering the holistic approach of the patient, to look after the causation of the patient, to look after the mental symptoms of the patient, to look after the general physicals of the patient. And so my prescription is Hahnemann's tinctura sine acris cali. So let's see the result, my friends. I shall share you after 3 months.